And welcome back at 6:49 this morning. Dr. Hong in the house. And this morning we're talking about a very serious respiratory disease.
We're talking about pulmonary hypertension, right?
Yes. And in fact, we're talking about this because next week is Respiratory Therapist Week.
Okay, so get a head start on it, right?
Exactly. So,
okay.
you know, you can call all the people at UVA to ask me to talk about something pulmonary, which I do every year. And I think this is a very serious pulmonary condition that a lot of people don't know, especially with people with sleep apnea, because they say, oh, Dr. Hong, I don't want to wear my mask. It's too uncomfortable. And I go, well, then, maybe you're going to get pulmonary hypertension. They always say, what's that? And I don't know if people really, care because it's just not, there isn't a lot of awareness about it. We have high blood pressure, which is called hypertension. But if it's specifically for the lungs, meaning the blood flow can't go through the lungs very well, then that's called pulmonary hypertension. And this is really bad because if you can't pump the blood through your lungs very well, it leads to a lot of shortness of breath. And so people walk a few feet and they're like, ugh, I can't breathe. And they're really not sure why. And a lot of people think it's initially heart disease, but what it is pulmonary hypertension. Some of the main causes of it, well, first of all, there's idiopathic, which in doctor's term mean we just don't know what causes it, okay? But one of the main causes is heart problems like aortic stenosis, mitral valve stenosis, valve problems, things that lead to backward flow of the blood into the lungs, things that lead to congestive heart failure. COPD, meaning for smokers, that's why you shouldn't smoke, with chronic bronchitis and emphysema. There's also obstructive sleep apnea, and because 2/3 of Americans are overweight or obese, and I say this more and more, and it's going to be 3/4 before we know it, because people aren't eating right, they're drinking too much sugar, and they're not exercising, it's leading to obstructive sleep apnea. And when you snore and back everything up, what happens is you don't get enough oxygen to some parts of the lungs, and the blood flow to the lungs in those sections actually turn off. It's like turn off electricity when you leave the room. It's the same thing with the lungs. The blood flow stops there, and it leads to high blood pressure. Also, certain drugs, remember fen-phen, those diet pills, that led to it, as well as also people who use IV drugs and cocaine. Also, if you have kyphosis, really poor posture or neuromuscular problems, you don't expand the lungs well, and that leads to low oxygen, as well as pulmonary embolisms, people who keep getting recurrent blood clots. So therefore, don't smoke, don't smoke, don't smoke, don't smoke. Wear your CPAP machine if you have sleep apnea, and also it's important for diet and exercise. There are some new medications that are out there, but right now we have some blood pressure medications that help the lungs. So anyway, and congratulations to all the respiratory therapists.
Yes.
All right, back to the basics, exercise and diet.
Yes.
Thanks.